Okay, ladies, today we're talking about some of the problems and solutions to some of the pelvic floor dysfunction. You might have seen our video talking about the fact that you have muscles down there and they can become tight or weak or dysfunctional or asymmetrical just like other body parts. And so my goal is to help you understand your own anatomy so that it might take some of the mystery out of when we have some dysfunction and give you some solutions before you get bounced around from provider to provider or medications or God knows what else. So when we have muscle dysfunction down there, of course, it can contribute to pain, including hip and back pain. Again, those muscles are like a hammock. And so if you might have gone to a massage therapist or been stretching or maybe had some physical therapy for your hip and low back and it just isn't going away or you're not getting lasting relief, you might have tension or dysfunction in the pelvic floor and that's hasn't been addressed, so you're not getting a more lasting result. Also things like incontinence, leaking pee, any bowel dysfunction, our digestive system and pelvic floor very, very closely linked, have a very strong impact on each other for either good or not. And so a lot of those things can be related to muscle tension and often help each other, right? So working on pelvic floor tension can help digestion, as well as we work on the abdomen, help better digestion, less abdominal tension can help pelvic floor. So it goes hand in hand. Sexual function, either pain with sex, issues reaching orgasm, tenderness with different spots, either on entry or being bumped deeper. Those are things that are usually muscle dysfunction. And so there can be scar tissue from different procedures or even things like PCOS and endo, which create a lot of inflammation, issues around our menstrual cycle. And so yes, those are inflammatory. Some might even have a genetic component and a hormonal component, but treating the muscles can often have a positive impact. And a lot of those, again, it goes kind of chicken egg hand in hand, where dysfunction there can create issues in the muscles, which are contributing to a lot of your pain and symptoms. And our fascia and that connective tissue won't be seen on ultrasound, CTs, MRIs, any of that. And so my hope again is that just knowing that those muscles can become dysfunctional and that they're fairly easily treated can empower you to know some solutions that you may not have been aware of or known about before. So if you're experiencing any of the things we were discussing, please reach out. I'm happy to help refer you to a pelvic PT in your area or even clarify whether or not this might be applying to you. Would love to answer your questions. We read every email and love hearing from you.